call the meeting to order if our technology folks are ready. I think they are. All right. We'll gavel our informational hearing to order. This is an informational hearing of the Senate E12 committee. There we go. This is an informational hearing of the Senate E12 committee. Today is August 20th, 2020. Members, we have a pretty full agenda today, and we're going to focus on a few key areas. I'll just kind of outline those for you. They were all in the agenda that was sent out. First, we're going to talk a little bit about the public health questions related to COVID-19 and students. We know that what we know about the virus is continually changing. It appears the virus is changing, and we want to make sure that we all are aware of the best practices, particularly as our students are beginning a new school year. And then we'll hear a little bit about accountability related issues. How do we know how our kids are doing? They went through 1 quarter of a distance learning, and now many will be returning in the fall to distance learning, hybrid learning, and some in face-to-face learning. But we'll get a little bit about that. It's so important that we know how our kids are doing. And then we'll hear from students and parents a bit about how was distance learning, how did that work out for them last year? And then look ahead to some of the innovations and things that we can do going forward to make sure that all of our students get the education that they need. And so with that, members, I'd like to introduce our first guest. I'd like to welcome Dr. Sarah Crane from the Mayo Clinic. Dr. Crane is going to speak about COVID-19 students, and also she has a special place on the Rochester Public Schools Liaison Group too, which was met significantly during the summer. So Dr. Crane, are you on? I don't see Dr. Crane. You'll have to unmute yourself.
And Senator, if I can add, this is Greg. If Nikki Villander and Kate Johansson would look around, if they know of a phone number, perhaps ending in 694, or anything else that we should be looking for as far as identifying Dr. Crane, because we don't see her named in the waiting room at this point.
This is Kate. Yes, we're trying to connect with Dr. Crane right now. She says that she is waiting to be admitted, so hopefully that will resolve it. But if she is not waiting to be admitted, I can let her know to try to join the Zoom again.
Sure. I think, Kate, I think we just need to know what the last 4 digits of her phone number are, so we can make sure we get her admitted into the room. And then also, I know it's being streamed live on Facebook as well too, but we need our presenters to actually be in the Zoom room. And if you want to text Jillian Reynolds, she can help you with that to make sure that we get Dr. Clark in.
Senator, we've just been joined by SJC18, who I think is Dr. Crane.
Oh, Dr. Crane, welcome.
Thank you. Nice to be here.
Oh, fabulous. Okay, Dr. Crane, thank you so much for taking time out of your day to join us and to give us a bit of an update on what do we know about the virus, what do we don't know, how has it changed, more importantly, how is this going to impact our kids as they return to their education and studies in the fall. And I know you worked extensively with the Rochester Public Schools. And if you could share a little bit with us about some of those best practices, the things that will be helpful for us as policymakers, but also for parents as they're preparing their children for return to school. So welcome, Dr. Crane.
Well, thank you for the invitation. Madam Chair and members, it is a pleasure to join you today. And as noted, we have had a very close relationship with our Rochester Public Schools over the last few months, which I'm sure is not unique. I think what this situation has pointed out to us is how necessary that link is between education and healthcare in times of pandemic, but I would point out even in times not a pandemic, to help each other keep our communities and kids and families healthy. My name is Sarah Crane. I am an internal medicine physician, and I am the primary care lead for Rochester and Southeast Minnesota, which is why the position of interacting with our communities and with our schools has been my privilege over the years. This morning, I thought we prepared a few questions which we thought might be relevant or common that we've been getting both from the schools and from others. So I'm going to touch briefly on those topics, and then I'm happy to answer any questions that members might have, just particular, and we'll do our best to help with that. A few common questions, though, that we get. First of all, the basic rules always apply. So I'm going to start at the top, and then I'll get more complex. But face masks work, double masking individuals works with both parties wearing masks. Social distancing works. And as I listen to healthcare presenters around the country on that, they keep repeating that, and for a reason. And as we talk about our kids going back to school, and I've been having conversations with the public schools, so many of the questions that come up is, how do we accomplish those goals? How do we get kids on buses? How do we get them lunch? How do we manage those types of guardrails? The virus sets the guardrails, and then it is up to our creativity to figure out how to safely work within those parameters. How to cohort kids so that we minimize the risk that if there is an exposure that we have significant downstream impact. All of those rules are assumed at the beginning of this conversation. Absolutely. So what do we know about how COVID affects children? So we just had an update coming out this morning. We know that about 9% of the cases across the nation are in children. I'm sure many of you have been watching some of the recent statistics come out suggesting that that percentage is climbing. We know that it's climbing certainly in the younger generations, 20, 30, 40-year-olds along the way. But we're also beginning to see the number in kids climb. We anticipate that that will continue and probably increase as we head into the fall. That is simply a reality that we are preparing for. Do children get sick from COVID? Yes, they do. As a population, they are less likely to suffer severe consequences, be hospitalized, etc. But we certainly have individuals with high risks that have ended up in hospitals. We have children in ICUs, and we have unfortunately had children pass. In addition, in our school settings, we run into the complexities of not everyone in the school is a child. And so our teachers, our educators, our staff are people that we have to understand the impacts of the choices that we make for them as well. One of the questions that's come up is, can children transmit this virus back and forth to each other, to other adults that they might be around? The short answer is this keeps coming. There are different iterations of this coming out over time. I think a few weeks ago, there was a published article from South Korea talking about the fact that perhaps children under 10 were fairly safe, that they were unlikely to transmit it to each other or to adults. Now we're getting just even this week, some articles coming out from Mass General, which is the hospital associated with Harvard, saying perhaps, wait a minute, they were testing kids more closely in a different setting and finding that a large number of them not only were carrying the virus, but were carrying heavy loads of the virus, even sometimes exceeding some of our adults in ICUs. That is an evolving area of science. And one of the big elements that I think people miss as they look at studies that I'd like to share today is what happens in those schools with those kids is a reflection of our community. If that study is done in a community where there's minimal presence of the virus, it will look like that. If that study is done in a community where there's quite a bit of it out and around, it greatly affects the results. And as we look around the state of Minnesota, we have different communities in different statuses. And as we live through the next couple of months of this experience and try to learn from it, we have to take that context into mind. So yes, children can get it. Yes, they can transmit it. Younger children seem to be more resilient in the face of this disease than perhaps adolescents are. Or as the mother of two teenagers, younger children might simply be more compliant with direction. And the superintendent and I go back and forth on if there's a cure for teenagers. And I'm not, as a health professional, going to go into that. But I honestly think as we've watched some of the colleges go back, that we're watching the reality also of the human interaction with this disease and the ability to manage our own behavior successfully and therefore create a low risk environment for each other. I think that's a reality in all of our schools as well. Questions about screening and testing. And I would share a story that I think many folks might have seen about Notre Dame came out recently. Notre Dame screened all of its folks when it came back. They had a very low prevalence rate. Within a week, it had quadrupled. And so there has not been a big push from the CDC. In fact, I believe they actually recommend against, for instance, mass testing people before they enter the building. You know, the start of school year, do we test all the kids and see how they're doing? That has been, aside from being practically challenging, it lasts only for the days that you did that test. And I think any of our colleagues on the committee who work perhaps in the aging area with our skilled nursing facilities would be familiar with the fact that screening means you've checked once. And so our protocols in those areas actually call for multiple monitoring. Is it a practical reality in our schools to maintain that type of a testing volume and frequency? We would love that to be the case someday. It is not the case today. There has been discussion about screening based on symptoms. In that Mass General article, less than half of the children had fever. In addition, I think the child's ability to reliably report that they have fever would also be a little bit of a challenge. I think here I respect any efforts that the schools are making to help with screening, emphasizing that if you are feeling unwell, you should not be coming to school until you get cleared, those types of things, and holding us responsible and accountable for our behaviors and for our families. Anything we can do in that area, but it's not simply as easy as shining a thermometer dot at our foreheads and saying you're good to go and we're safe. We shouldn't carry that illusion, and that is a very high, that's hard to do en masse, simply looking at folks that have tried that in the past. Screening becomes a difficulty. I'm happy to talk about if people have often specific questions about after we screen and people are coming back positive, what we do. I think that's evolving almost individually within different counties, different public health teams, and different schools, but an area I think we're going to learn an enormous amount about this fall. One of the other questions that we get is about vaccines. I will tell you where the bedding pool is in my own staff room. Currently has us in first quarter, probably around February, as being when we will first see any meaningful volume of vaccines out. It is not, that is, the bedding pool in my staff room is not a scientific statement, but in terms of looking at Dr. Fauci or others who I feel probably have a more intimate knowledge of the actual status of vaccine development, that's roughly the time frame that it appears that they are consistently sharing. Just because the vaccine is here, that does not mean that we have figured out a way to immunize 300 million people in this country overnight. And one of the things that I think schools and healthcare organizations need to be thinking about together is what happens when that occurs. For those who are familiar, in Rochester, we offer the flu shot to children in school through mass immunization. We can't do that this fall. They're not in school in Rochester, where distance learning is predominant in middle school and high school. But we are looking at new models of mass immunization, socially distanced, very safe, to try and get mass numbers of people through. And how can we partner with the schools in that space to make sure that our children are all covered? I think the other thing that comes up when we start talking either about testing or immunization is making sure, and very deliberately including in any plans that areas are making, outreach to our highest risk populations, whether that is socioeconomic, cultural, language barriers, that not only do they have our highest prevalence rates, they also have our highest complication rates. And if we are not intentional and do not plan ahead, we will not succeed within that area. So I hope that all of us on this call are taking note of those opportunities as well. I don't want to come across as saying that this is all, that the risk in the decisions that we make this fall are all about the virus. The risk to lock ourselves at home and not send any kids to school is just as serious. and is a balancing act that all of us acknowledge. You all are probably a greater expert in this than I. The risks to children of staying home, of having inadequate internet access, of having inadequate family support. As two teenagers, I'll tell you, they're getting a little bit about being told when they, weren't going back to school. We acknowledge the mental health impact, even the physical health impact of the lack of mobility, sports being a challenge this fall, et cetera. I don't want to downplay that. I'm not sure. The American Academy of Pediatrics just came out with an updated version yesterday. I want to say that I think would be a good resource for all of us to look into. And what it emphasized was the need for investment regardless of the model that we start out in. So if we're talking about distance learning, we should be investing in filling the gaps that are in those places. If we're talking about face-to-face learning, we need to make sure that we've made accommodation for those for whom that's not safe, either because of their own health issues or because of their families. And so that it's not going to be a clean one or the other model, and we have to accommodate that diversity across that spectrum. And it's going to take more resources potentially to do that if we really want to try and support our children during these difficult times. And with that, I would share one last point, then I'm happy to either talk to other topics, answer questions, which any of the members might have. But one of the things we've been emphasizing in our conversations with our local schools is flexibility. The scientist in me is fascinated by what's happening this fall. We're about to conduct the single largest experiment that I have ever seen, with each school district essentially its own version of that. As I'm sure every parent is and every administrator, I don't know if I'm more curious or frightened by this experiment, but 6 to 8 weeks from now, we're going to know a lot more than we know now. And we have set with our own local schools plans to meet with them around the 6-week mark, which is MEA, and say, where are we at? What have we learned? Have we learned to do things safely so face-to-face is more possible? Have we learned that really we can't do that, that we end up with everybody in quarantine anyway, and this split decision is not really an effective compromise sort of thing? That 6-week is not an incidental number. It is based on the fact that we will be getting information from everyone's experience. But on the medical side, when we watch for the impact of this decision on our communities, it takes about 1 to 2 weeks for the first wave to come. We send the kids back to school. We watch the kids become positive or not positive, depending on how that goes. Second wave is their immediate contacts, other kids, their parents. Third wave is now moving out into the community where we're watching community to community spread. And so from a public health standpoint, when I meet with our public health team, we're watching for what we think of as that third wave. And that's where we'll actually see some of the meaningful numbers about what is the effect that we're making. I mean, the analogy, which you'll all be familiar with, is when different states opened up bars or whatever it was that they loosened up, they didn't see it that first week or two. And they all said, oh, we're good. This is going really well. That is not the time frame where we will be able to make informed decisions about what the effect is of what we have learned, the different options are. So really making sure that we're watching, we're looking at a meaningful time frame, we're incorporating more information as we go, and that we're flexible and adjustable within this space. And then just a moment to say that as humans, sometimes there's not a right answer. There is no precedence for this. We are doing our very best as healthcare individuals and as educators and as legislators and as leaders within our communities to make the safest decision we have in a time when the science is very, very much evolving. And so supporting each other, not being overly critical when one goes one way or the other, but trying to find solutions that make all of those options better, I think is a level of forgiveness we have to give ourselves as we head into this process. And with that, Madam Chair, I'm open to any questions that you might have.
Thank you, Dr. Crane. That was an excellent kind of a recap and look ahead and some wise advice there about working together. And I do believe that there's just great concern and hope that we must all focus on our students' well-being, both their health, their physical safety, certainly um, their mental stability and wellness as well. And then, of course, not lose sight of those academics, which is why we have our kids in school. So, Dr. Crane, thank you for that. Good recap. I have just one area that I'm wondering if you could get a little bit more in depth into. I know we're pushing up against the clock here, but today there was a new report or a new piece about these, and it kind of gets into that symptom screening or symptom monitoring. And obviously, children or even parents might have a difficult time, like reporting temperatures, for example. That leaves a lot of variability. But my question had to do with, I had heard a report this morning about these, I don't know exactly what they're called, symptom kiosks or something that some schools are using, which is kind of as students come in, there's a kiosk where they, all safely either maybe it's I don't know, an oximeter, a temperature, they just check their respirations. I'm just not really sure what's all in that kiosk screening that some schools I understand are using. Do you have any, are you aware of that, or do you have any information on that particular kiosk screening?
Yeah, so I had not heard of that, but I've certainly heard of versions of that. And I'm having an immediate, almost emotional reaction to the word kiosk because it implies touching and a bunch of children touching.
Oh, no touching, they said. Yeah, no touching.
Bear with me.
Good point.
There's a moment. I'm touching. So what, setting aside the kiosk physical question, there has been some recommendations on this particular explorations of this. And I think one of the issues is how much effort it takes to invest in that versus how much we actually protect ourselves by doing that. So for instance, coming back to that Harvard study that of children who were tested for COVID, and they were tested for a variety of reasons. Some were symptomatic, some were not. Less than half had a fever. We know that particularly in younger children, the chance that they are symptomatic is a 50-50 event. So to be of the understanding that someone is coming in and we're screening them and therefore we're safe to keep going, that would be an inadequate conclusion along the way. Having said that, I have been the parent of a child, and to be completely honest, my child woke up with nausea yesterday before she was supposed to go to soccer. And I also know that, which by the way, she's been tested, she's negative, all as well. But the point of that is, how do I phrase this? You have to be honest for questionnaires to work. And the motivation now of people, of students, of families to be in school, not in school. In the old days, it was just, did we go to school with a sore throat or pink eye and feel bad about it? We are reaching a new level of process and pressure in that setting. And I know, for instance, in the Rochester Public Schools and public health, we ran into a problem with our teenagers. Once they tested positive, they didn't even want to share their contacts with us because it was considered outing your friends, who were then going to be put in quarantine for 2 weeks. So when we asked children at the door, do you want, have you had any symptoms? Most people are very honest. I'm sure the same is true of children, but the kids want to be there. And all those types of things. We have to acknowledge even some of the challenges that we've seen with screening being adequate to really keep us safe. But I don't think that excuses us from continuing to be very clear with parents and families that it is their personal responsibility in that setting. And if some form of screening or conversation or checking continues to emphasize that, then I think that there is absolutely some role for that. It's just a matter of how much resource we have realistically to invest in it, and whether we take that as a false sense of security, which leads us to not as closely follow the other steps that we really should be doing that are perhaps more evidence for their effectiveness at keeping us safe.
Oh, thank you for your input on that. The price I heard today was $3,000 per, I think the term they used was kiosk, but it was non-touching, of course. But I think you bring up a lot of good points, and we'll just have to kind of watch and see how that plays out. And my sense is it's going to be a multi-pronged approach. There's so many layers that we need to put on, and kind of like that Swiss cheese example, you have Swiss cheese with all these holes in it, and you just keep putting layer after layer after layer on top, and trying to kind of plug those holes or those areas of contagion. So thank you very much. Thank you very much, Dr. Crane. And if members have questions, we will be glad to get those submitted to you if you wouldn't mind. But again, I want to thank you for one being a critical worker right there. You've been there all along, and then really for investing in our schools also. That is so important. So thank you, and good luck with those teenagers as you start this new school year. Thank you, Dr. Crane.
Greatly appreciate the invitation. Thank you.
Thank you so much. And then members, our next guest is our Education Commissioner, Mary Catherine Rickert, and her staff. Just to kind of give you a layout of this, there's a few questions, and certainly the commissioner will be with us. And then also she has a few staff members that will handle certain parts of our presentation. We plan on about 20 minutes for the presentation, and then about 5 minutes for questions. So with that, Commissioner, are you there?
Yes. Good afternoon.
Welcome.
Can you hear me all right?
Welcome to the committee, Commissioner.
Thank you, Chair Nelson, and hello, committee members. Thank you for inviting my team and me to this hearing today to testify on a range of areas impacting our students, families, and educators in their learning environments during this pandemic. Before I give you some comments on the important areas you asked us to discuss, I'd like to briefly update the committee on where we are with this coming school year. As you know, on July 30th, Governor Walz signed Executive Order 2082 and launched Minnesota's Safe Learning Plan, which laid out how districts and charter schools, along with their incident command teams, would determine which learning model is safe to implement for the coming year and how to shift between them. And so whether it is in-person, hybrid, or distance, districts and charter schools must look at the COVID-19 county case rates and their local capacity to implement safety requirements in order to establish which model is right for them. The Safe Learning Plan, which was created in collaboration with the Department of Health, Department of Education, and the Governor and Lieutenant Governor, provides robust and detailed guidance to schools to help them navigate this process. The Department of Health and Department of Education, in addition to other agencies, have also created an array of guidance documents, which we update regularly to assist school leaders and families in planning for the upcoming school year. Other efforts include weekly calls with school leaders, distance learning advisory groups, regular outreach with education partners, and feedback groups with educators and families. In addition to our local planning and implementation efforts, the Walz Flanagan administration has directed roughly $430 million to respond to the educational and safety needs for our K-12 schools. I want to take a moment to thank Senator Nelson and the LAC for approving these funds. As you know, a majority of the ESSER funds went out to school systems directly to keep students healthy and connected to learning. The remaining portion was state-directed toward school systems to support technology needs, mental health supports, and historically underserved populations of students. The GEAR funds were directed toward technology access, summer school programming, and 0 to 8 wraparound services. And the most recent source of federal funds, the coronavirus relief funds, have been directed toward operating costs and supporting student, family, and educator needs. And I want to thank you for the opportunity to briefly discuss the Safe Learning Plan and support schools have received and will expect from MDE for the upcoming school year. Today's opportunity to participate in this hearing is an opportunity to see that from the beginning of the pandemic, the Minnesota Department of Education has taken an all hands on deck approach to supporting students, families, and school communities. In those areas, we are going to be discussing. Jennifer Dugan is with us, our Director of Student Testing and Assessments, who will be reporting on what is happening with local assessments, what the MCAs will look like statewide, and any best practices for assessments from other states. We are preparing for in-person administration of the MCAs this coming school year, and we are looking for the options available to us, which includes inviting some districts to pilot remote statewide assessment, which will help refine policies, strategies, and practices. I am really grateful for Jennifer's focus and her counsel. Additionally, I do want to state that we are approaching assessment holistically. It is imperative that educators welcome students back and prioritize the social and emotional needs of our students to improve those conditions for learning. It is also imperative that the first assessments teachers do are meaningful local measurements that will be shared with students so they understand where they are, shared with families so they can be reassured, and used by educators to plan the path forward that our students deserve. Deb Hewitt, our Interim Director of Early Learning Services, will discuss multiple initiatives to support early learners during the pandemic. As you know, unfinished learning is at the top of our priority list as we ensure we are providing support to educators to address learning acceleration, given that students will more than likely be in all three learning models throughout this year. Early literacy skills are key to becoming a successful learner. Our teams at MDE have and will continue to focus on how we can best support families and educators through each of these models while maintaining a strong focus on early literacy, numeracy, and social emotional skill development. Deputy Commissioner Dr. Heather Mueller will discuss work around multi-tiered systems of support and enhancing student engagement. We have been hearing from almost every group and every corner of the state that student support, especially mental health, should be at the forefront of efforts as we come back to school this fall. Addressing the need of the whole student will be crucial to helping our students feel and fully supported and succeed. And Sharon Peck, our data management supervisor, will provide information on student attendance. We have been working with schools on how to keep students engaged and participating in instruction with a focus on attendant practices as a student engagement strategy. Finally, Assistant Commissioner Darren Cordy will discuss guidance around non-public pupil transportation. We have heard from our non-public partners and families the need for support for transportation of their students. We are working to encourage greater partnership between our public and non-public school communities to solve this issue. And we continue to update our guidance accordingly and will remain vigilant as learning models change. The common thread through all of our presentations is the expectation and commitment we have to solving problems and persisting alongside our school communities to meet the needs of our students and families. So, Madam Chair, again, thank you for the opportunity for my team and me to present to you on a range of issues, and I am available for questions after the presentation.
Thank you, Commissioner. First, we'll welcome Jennifer Dugan. Welcome to the committee, Ms. Dugan, Director of Student Teaching and Assessments. Let's talk a little bit about how do we know what our kids know and what they don't know after this last quarter of distance learning, and then coming up this fall, there will be more distance learning, some hybrid learning, maybe some face-to-face learning in some places. But one of the questions that we've heard so much about is, how do we know what our students know? And if you could address that for us, that would be so important. We do not want the lingering effects of this pandemic to manifest itself in students year after year because they have not gotten the education that they deserve and require. And so we just want to make sure that we're not seeing kids who aren't learning to read, for example. So I appreciate that focus on early literacy. because that will manifest itself year after year, long after we have learned how to live with the coronavirus and our lives have returned to somewhat normal. Will never be quite the same. But so that would be my question, Ms. Dugan. So welcome to the committee.
Thank you, Madam Chair. Jennifer Dugan, Director for the Division of Statewide Student Assessment and Data Analytics at the Minnesota Department of Education. And I think in many ways, I took some notes as Dr. Crane was talking, and in many ways, what she was talking about as we monitor what goes on in those first 6 weeks as far as related to the coronavirus, I think very much parallels what we as an agency are asking districts to do in monitoring where student learning is, thinking about collecting the information that we need to, having a meaningful time frame of collecting that, and having an action plan. And so when teachers and educators are planning for an assessment, being very purposeful in making sure that that assessment is aligned to the Minnesota academic standards first and foremost, and making sure that that alignment is strong, and they know what they're going to do with that data once they have collected that information. And we're really encouraging the formative assessment piece. So being sure that even with that formative assessment, that they know that that's aligned, the questions that they're asking are aligned to those standards, and that they know what action they're going to take as they're assessing where their students are at in the classroom as they do enter into this fall in an unprecedented way. So first, again, really being sure that that alignment exists, and we're providing some additional resources. I'd be glad to talk about that, of additional resources and supports that we are trying to provide to districts as they understand what is really being called for the full depth and breadth of those in the academic standards, and being sure that what they're asking students and sending home information to the parents, so the parents know where the students are as well, that there's purpose and there's a plan for that assessment. So we do not have, at the state level, we will not be collecting any data this fall, but we are actively supporting districts, thinking about, as Commissioner Ricker mentioned, thinking about the whole student as they are thinking about assessment and starting off the school year. So we have some modules that have started. The first one was yesterday, and then there will be one every single month throughout the school year, really focused on assessment and thinking about how we can support educators throughout the school year.
Ms. Dugan, what does that module look like? So you're the monthly modules for educators, and what does that look like? Just give us a little more detail on that, if you could, please.
Absolutely. And I could go on and on. So I want to be sure I respect the time and everybody gets their time. So yesterday we started out much from the broad sense of, there was a panel of 4 educators across the state that talked about how is this year different as you're beginning this school year? How is assessment look different? And really thinking about reimagining how we instruct and how we assess. So it was very general and just getting folks thinking about how we want to do assessment differently in remote settings, but also in this time of coronavirus. And then the next session, which I believe is next week, will start to focus more specifically on, for example, formative assessment, and then we will move into some more of the details related to summative assessment and creating more meaningful, maybe common assessments. Again, really hitting that, emphasizing the alignment to the academic standards, and then thinking about all of the data that we provide at the state level related to the statewide assessments, and being sure that educators are using that information that they have available in an aggregate way as they are planning their lessons.
Thank you. I'm a little confused on the alignment, because I would assume that our tests are already aligned to Minnesota standards. And so we can talk more about that offline, But again, I just want, and we'll get more on the assessment too, but it does sound like we're going to miss maybe a year of knowing how our kids are doing, which is very frightening. And so we'll want to delve more into that, make sure that not only we know as policymakers, but more important, parents know. Parents know how their children are doing. They know if they're aware if there's additional help needed, and they also are able to know that their kids are in a school that where kids are achieving and doing well. So we'll look forward to some more discussion points on that, but we will move on to to the rest of this presentation, and then we will take some questions. So if you can stay on, please, that would be great. Ms. Dugan, did you mention though the MDE's I think plans for MCA's assessments in 2021 in this coming school year? Did you say there will not be MCAs, but I might have thought I heard the commissioner say there would be. Can you just kind of address that one question quick, please, before we move to your calling?
Absolutely. So yes, we are absolutely preparing for MCA, MTAS access and alternate access administrations for the 2020-21 school year. We're absolutely in the thick of that preparation. Additionally, as the commissioner mentioned at the beginning, we are also that preparation is in preparation for in-person assessments. And as we think about what's needed, and to your point, Madam Chair, about the importance of this data and thinking about what we need to know as a state, we realize our duty to investigate remote testing. And so we are going to partner with some districts this fall and start down that path to see what is needed from policy in order to protect student privacy and what procedures need to be in place to make that a reality. So we're preparing for in-person, exploring the remote testing, and also seeing if we can put some tricks up our sleeves as well if we get thrown another curveball.
Thank you very much. I appreciate the preparation, and I'm sure we'll get back to that. Next, I believe we have Deb Hewitt, Interim Director of Early Learning Services. If you could talk just a little bit about, I know we've mentioned briefly, but it really is a key point, which is that early learning, early literacy. And if you could address that for us, because that just does set the stage for so much of what happens after that. So welcome to the committee, Ms. Hewitt.
Thank you, Madam Chair, committee members. I'm Debbie Hewitt, Interim Director of Early Learning Services, and I want to share some of the support that the department is doing in order to provide support for our youngest learners and their early learning abilities. We have received a federal comprehensive literacy service statewide development grant that allows us to support 12 districts and charters through subgrants to align strategies for across a grade and from one grade to the next, and that will help us promote scaffolding of skills and abilities. It'll focus on several evidence-based practices, such as working with families to promote their home language and to create literacy-rich environments. And those will be introduced to staff in all districts, who can then use those evidence-based practices as part of their conversation and further professional development in learning communities and in coaching interactions throughout the year. We're continuing to work on language essentials for a teacher of reading and spelling, known as LETRS, by having 25 LETRS facilitators who will support a cohort of teachers as they continue to develop their teaching skills in literacy areas. During the Family Engagement Week that took place during early June, we recorded live webinars sharing literacy and math suggestions for teachers and parents to support summer learning, but these can also be used throughout the year. We've got multiple guidance documents posted for families and teachers that promote oral language and early literacy while they're engaged in any of the 3 learning models. And we continue to support the implementation of the kindergarten entry profile, which is a menu of 4 tools or assessment tools to help teachers and schools better understand what children know and are able to do. Each of these has the language and literacy component. We recognized the need of teachers last spring to continue their own professional development in the assessment tools. And so we pivoted to online trainings. We offered trainings for administrators and leaders to enhance their data literacy. And finally, MDE is working to create strategies teachers can use as they partner with others to collect the information that they would otherwise collect in person, but now may need to do online. Madam Chair, committee members, that concludes my remarks.
Thank you, Ms. Hewitt. And if you could stay online, because when we finish with our, we have a couple more testifiers here from MDE, and then we'll make sure that we have some committee members who may have questions. So thank you so much. Next up, we have Dr. Heather Mueller talking about student daily contact and how do we routinely, how do our teachers, how are our educators going to maintain that necessary contact with our students? So Dr. Mueller, welcome to the committee.
Thank you.
Yourself for the Zoom, please.
Yes, thank you very much, Madam Chair. Good afternoon, members of the committee. My name is Heather Mueller, and I'm the Deputy Commissioner with the Minnesota Department of Education, and we really appreciate having the opportunity to come and speak with you today. One of the questions that you asked, Senator Nelson, is what is being done really to help to ensure that students that do not get sufficient daily contact are routinely reached out to and instructed this fall. And the way that we're talking about that really is something that is paramount. We recognize that relationships is one of the foundational principles really of education, is how do you build those relationships and maintain those connections, not only with the students, but with their families. And we know that in a distance learning model, that was a little more challenging over the spring, and we really had to figure out how it is we were going to hone our skills in that. And so the place we really went back to is something I think that you are all really aware of, and that's a multi-tiered system of support. In thinking about a multi-tiered system of support, it really relies on multiple tiers to support academics, behavior, and social emotional learning that really works together as a safety net to prevent school failure. And they offer really critical features in a school-wide framework. It really helps us think about what is the core instruction, what are we going to be doing for every single student, and what are the systems and structures and processes we're putting in place to ensure that we are reaching out to students, building those relationships, and what are the expectations. And then finally, how are we going to communicate that with our families and with our students, so that we know that we have entered into it's not a formal contract, but really an agreement on how it is we're going to do our work together. And so most schools, districts and charter schools actually have an existing MTSS model that's established for academics and behavior. And we really believe it's an appropriate opportunity to maintain that model, as well as integrate regular academic engagement and attendance. And so we put together a document for our school districts in phase 2 of distance learning, and we are continuing to hone that as we are working with school districts in this and with some of our partners at DHS as well, is really to think about how it is that we can communicate the implications and be thoughtful about first, and I think you talked about this, Madam Chair, is just how are we going to think about students' mental health first? How are we going to think about that piece in addition to those relationships? So one of the things we did add in our guidance and are being thoughtful about as what we're doing for every student is really thinking about what we know about and working with individual staff, with individual families, and with individual students about the impact of COVID-19. Also communicating the implications of COVID-19, the way the school operates and how it is we're going to be clear about that. It comes first in our communication around how it is we're providing mental health supports and what that's going to look like, and then really creating a communication outline that everyone is aware of and can actually, I think, meet together within. As we're thinking about universal strategies around engagement, we think about that in two different ways, because engagement and attendance, as I think a number of people on this committee know, are two very different things. They can be aligned, but they are not necessarily the same. And so when we are talking about engagement, really engagement is the commitment to learning, a sense of belonging, and the willingness to participate in learning that's associated with positive student outcomes. And so how it is that we've talked about this and put this into an MTSS framework is that teachers are really looking at verifying engagement daily. How is it that we are working with them in academics and building those relationships in some ways, but they're not limited to all of these ways. Is some ways it is in classroom assignments, participating in class activities, taking an exam, participating in an online discussion, initiating contact with teachers about a subject related to a class, and then a framework to be able to do that, and then communicating with families around that. Now, we also know that engagement, because it is different than attendance, it's also reducing chronic absences that really are fit nicely into an MTSS framework, because the role is really to ensure that we have clear attendance expectations and ways to communicate with students and families how we are going to support them if attendance is becoming a problem. It's not going to work the same as it did when you were in a traditional school building setting. And so when we're talking about attendance, it's really daily communication between teachers who are not academically engaged. If they're not turning in any of those assignments, they may be logging on every day but not doing any of that work. The attendance piece comes in really looking at what if we have students who we are not even hearing from, and that becomes an area where we're concerned, right? I think we all talked about that in our distance learning the last time, is because, right, having students come in face to face, you at least get an opportunity to see their physical health and well-being and have the opportunity to check in with them. In a distance learning, if we are not able to talk to them or connect with them via some type of technology, we worry about where they are and what's happening. And so ways that they can do that is you can also try phone calls, emails, internet-based face-to-face platforms, thinking about doing home visits, right? Not in a process that is punitive, but to ensure that we are connecting on that human and really relationship-based level. And so those are some of the pieces. And then recognizing that if you haven't seen a student or no personnel have had contact for 2 days, then there needs to be something. We need to elevate and really move that forward, because that is, again, in the attendance piece and then in the engagement piece are two different. So we've created the document and are really working with our school districts and charter school leaders on implementing what this looks like. There has been a webinar based off of this, and we are going to continue to do some of this. This is part of what is coming up in some of our supports. But it really is looking at delineating the differences between academic engagement and attendance, and then the supports that we have in place to be able to do that work. And with that, I'll yield the floor.
Thank you, Dr. Mueller, and thank you for bringing that forth. There's a big difference between attendance and engagement. You have to have attendance to have engagement. And I would just say that it was quite shocking the last time we met. I believe the information that I received was that about 30% of our kids, we never heard from them after March 13th. That is, I hope I'm wrong, but that was the information I was given. That is shocking, absolutely shocking and worrisome. And if you could just elaborate briefly on that attendance policy. In questioning that, I think I was told that parents were not involved or called upon until the child had missed 3 times. And to me, that's, 3 times too late. But I heard you say today that you have a 2-time. If a student is absent for 2 times, then there will be some outreach to the parent. Could you just kind of clarify that a little bit, if that's,
Sure.
if my understanding is correct? And if that's the case, why would you not do that after 1 time? I mean, that's what we do in school. If a child doesn't show up for school, we contact the parent right away. We don't wait until the 2nd day or the 3rd day. Can you do just a brief update on that, please?
Sure, I
Dr.
appreciate
Mueller.
that. Yep, I appreciate that. Thank you, Madam Chair and members of the committee. So I think a couple of things. One is that the 2 is at the latest, like no more than 2 days, a number of our districts and charter schools have actually are looking at a 1 day. Like if we haven't heard from you and nobody has, then we're going to reach out after a day because we want to know where students are at. And I think that is the concern that our committee that your committee and as well as I think our communities and our staff were really worried about is we don't want to miss out on where our students are at. And so we really do want to know where they are and if we are not hearing from them. And so the 2 days that we identified was at 2 days. But a number of our districts and charter schools are saying 1.
All right, thank you very much.
Thank you.
And stay tuned. We will be listening to Sharon Peck, our data management supervisor, next. And you're going to talk to us a little bit more about this attendance versus participation, and what kind of data can you share with us? Maybe you can put our minds at ease to think, that we're not going to have 30% of our kids who miss an entire quarter or more of school. So Ms. Peck, welcome to the committee. Introduce yourself for the Zoom call, please.
Thank you, Madam Chair, committee members. I'm Sharon Peck. I am a supervisor in the data management team of the school finance division. So I'm coming at this from a school finance perspective. Dr. Mueller has done a nice job of describing the engagement, expectations, and hopes and attendance participation for students this coming school year. So let me focus my comments on the actual data collection, attendance data collection that we have done for last year and our plans for this year. So last year we posted, under statute, the commissioner has authority to waive the 15 consecutive days withdrawal provision. It's in the finance laws. Students who are absent 15 consecutive days must be withdrawn so that no further state aid is paid out until the student returns to school. So we posted an application for schools to use to report students that were absent beyond 15 days. The allowances for what would be allowed were fairly broad, as long as the school had some contact with the family, they knew where the family was, they knew the family was trying, they were eligible to apply under that waiver, and districts could keep students on the rolls beyond 15 consecutive days absence. The rules for the waiver for the 2021 school year would be tighter. Because we have distance learning in place for students, all districts and charter schools need to have a distance learning program in place. If the student is too ill to participate in distance learning, that's a scenario that would be approved under the waiver. But lack of participation, not knowing where the family is from finance purposes, those students would meet the 15-day withdrawal, and then there would be funding implications. So of the application that we sent out for the 1920 school year, I would say I was a little disappointed in the response rate. So we've sent out a few reminders, including another reminder this morning. And this time we asked, if you didn't have any students that met the 15-day withdrawal, would you let us know that? So at least then we know, did you ignore the application, or were you really able to stay in touch with all students? And the email this morning was overwhelming. And the majority of those emails were, we didn't have any students that we lost touch with or that weren't absent beyond days. So of the applications that we did receive from school districts, half of the students were absent for 20 or fewer. It ranged all the way up, but it was a little bit reassuring to know that long time to be out of communication with school, but at least we weren't having the majority of kids gone for 40 days.
Thank you, Ms. Peck. You may have more. I just want you to repeat that. There was a glitch maybe on other people's end, but mine as well, on mine for sure. I couldn't hear what you said. So 20 days, the maximum was how many days?
Yep, the range was from 16 to 45 days. Half of the students that we got reports from so far, and I know we will get more, half of the students on the report so far were 20 or fewer consecutive days. That's not good, but at least it's not most were gone for 30 or 40 days.
Okay, thank you. Is there any more, Ms. Peck, to your testimony today?
No, unless you have questions.
Okay.
Thank you.
No, thank you. I would just note that well, we are concerned about the funding. We're really concerned about the kids not getting the learning and the teaching that they need during those times of absence. So I believe that is all that we have of testifiers from the department, Minnesota Department of Education. I do see a couple questions here on the side, and and these are for our MDE folks. And I think the first one that I see is Senator Uyghur. I think you have a question for the department. Senator Uyghur.
And then Senator, if I could just insert, this is
Yes,
Greg, you'd also
Marcus.
asked for the department to speak about the transportation issue.
Oh, yes. All right. I'll address that first, and then we'll come back to Senator Uyghur. I know he has a question for the department as well. Thank you. And I do want to address this while we do have the department here. This has to do, and Commissioner, I know you mentioned this, it has to do with the transportation for our non-public schools and the executive order and then that original guidance. And so I appreciate the fact that the guidance has been clarified. But let's just, before I actually mention that, I'm thinking, let's see, is it, Ms. Hofer, do you have the information on non-public transportation that you could share with us?
Thank you, Madam Chair and committee members. Madam Chair, you requested information on the funding formula for non-public pupil aid. So there is a memo that I wrote that I believe has been distributed to members of the committee and is linked on the website. So just briefly, I will walk through that so the members have the information you requested. So under Minnesota statute section 123B86, this requires a school board to provide equal transportation services within the district to all students, both public and non-public. The non-public pupil transportation aid appropriation provides funding to school districts for expenses related to providing the regular and excess transportation services, as well as non-public, non-regular transportation services. So essentially, the amount of non-public pupil transportation aid a district receives is based on three things. So first, the district's actual transportation expenses in the second preceding year. Second, the number of non-public pupils transported in the current year. And finally, the change in the basic formula allowance between the current year and the second preceding year. Since the formula uses some data from the second preceding year, this means that the aid entitlement for fiscal year 2021, for example, is calculated using fiscal year 2019 data on actual costs. So in other words, the 2018-19 school year expenses are used to calculate aid that's distributed for the 2021 school year. So since members have a copy of the memo, there is a more detailed formula there that you can look through. And I'm glad to answer any questions the committee might have on the funding formula.
Thank you, Ms. Hofer. And I also jumped ahead just a tad. I believe that we have one other testifier. Our Assistant Commissioner, Darren Corte, was going to give us a little bit more information on the non-public transportation. So Ms. Corte, Mr. Corte, welcome to the committee. If you could introduce yourself for the record, please.
Sure. Thank you, Madam Chair and members. My name is Darren Corte. I'm an Assistant Commissioner for the Office of Student Health and Wellbeing at the Minnesota Department of Education. I just wanted to speak a little bit about the guidance document since it was mentioned. We had a lot of questions when our guidance initially came out and the decision and the executive order came out about what was going to be happening in the fall in regards to non-public transportation, and particularly about situations where the district would be operating in one model, but the non-public school might be operating in a different model and on a different schedule. So the purpose of that document was to really outline kind of the same things that that the fiscal analyst just talked about there. Just what are the minimum expectations that the statute sets out for districts when it comes to transportation of non-public students. After that guidance was put out, we did hear some concerns from non-public schools, their families. We heard from some legislators, including Chair Nelson, that school districts were maybe using this guidance to say that they can't provide transportation to non-public students on days that the public school students are not being transported, that somehow this guidance was not allowing that. That was certainly not the intent of this guidance. The intent was to outline the minimum statutory requirements for transporting non-public students, and it certainly wasn't our intent to say that they couldn't provide additional transportation if they were able to accommodate it. So as you pointed out, we have updated the guidance to clearly ask that school districts collaborate with their non-public colleagues to find creative solutions that work for both the district and the non-public schools when they're operating on different in-person schedules. We also added information about the option to reimburse families for parent-provided transportation. And we added a reminder about how the formula works, and that if there was a significant decrease in services and expenditures for this year, it could have a negative fiscal impact on schools in fiscal year 23. So that's the only update I wanted to provide, and would be happy to answer any questions when we get to that point.
Sure, thank you. We will start with our questions. I'm gonna, while you're there, Mr. Cordy, I'm just gonna touch on this non-public transportation piece, and then I know we have some members who have questions for some of your other team as well. So the law and the funding, as we heard from the state, are intended to provide safe travel for our non-public students. And this has been in place for several decades. It's been upheld as constitutional by the Minnesota Supreme Court. It's what we expect as Minnesotans, and what we have funded as legislators. And so the scheduling disruptions and the unprecedented scheduling due to COVID-19 really should not impinge on the transportation rights and the safety of non-public school students. And so I appreciate the fact that the guidance has been updated, but I do think there's a couple things that maybe I just didn't hear clearly enough in your testimony, and maybe they're just there, but I do want to make sure that the public is well aware of that. And that is that parents can be reimbursed. So non-public school parents file a reimbursement with the school district if in fact their children are no longer able to be transported. That was not in your original guidance, but I believe it has been corrected now. It's very important that parents know that that is an option. So if the school district for some reason is not providing that transportation, that non-public school transportation, which it should, as our law states and as it has been funded, but if for some reason this collaboration isn't providing for that transportation, parents do have the resource then to be reimbursed from the school district. So I think that's an important piece. And I would ask the department to consider the timing on this. So the updated guidance is good. It's a step in the right direction, but to think about that, the department really spent most of the summer in intense planning for what school was going to look like this fall. And on August 6th, after that summer of planning, of course, the governor came out with a model that, quite frankly, I'm pleased he listened to the legislature and to parents about the fact that a one-size-fits-all does not work. And so there's this flexibility built in, which does lead us to the fact now that schools are preparing for all types of learning. But it was not, I know I wrote my letter on August 11th to the commissioner and the governor about the non-public transportation piece. And I'm sure, as you have said, other legislators and such had concerns too. And so that guidance is important. And so I'm glad that parents are going to know about that reimbursement. We need to make sure that parents are aware of that, and that will be up to those non-public schools to make sure parents are aware. My question is about the timing, because it was just, I think parents are going to be given just 5 days basically, because I understand your guidance says that they need to let the school district know before the school starts whether their child is going to be using non-public transportation. And that would be a reasonable request if it was made back even on August 6th, but it could have actually even been made, back during the summer as well, because that is our law. And so I'm just very concerned that parents are being put in a box here with a very short time frame to ask upon this. So I'll ask if the department can relax that very short time frame that we're asking parents to make that decision. And so we'll just kind of leave that there. And I would just mention that we need to make sure that we do talk a lot about equity in education. We know that education is a great equalizer, and we have to make sure that we're not limiting students' ability to learn because of this COVID pandemic, and that we continue on with our laws. We do not want students to be deprived hours of learning because the school district has said we're going to go to hybrid or distance learning. So just wanted to kind of put that out there for you to consider as you move forward here. And it is of an immediate nature. It's just too short of a time frame to give parents a 5-day notice like that. And so those were my questions on the non-public transportation. But I do see here, I think I had called on Senator Uyghur, had a question for one of our Minnesota Department of Education officials. Senator Uyghur, are you there?
Yes, thank you, Madam Chair. I have several questions, but how much longer is the hearing going to go?
Well, we only have from 1 to 2:30. Oh, so we need to move on. I see that. Yes. Okay. I'll tell you what, if your questions are such that you can submit them, we will make sure you get answers. But I do want to make sure you have an opportunity to speak, and thank you for drawing my attention to the clock because we do have some other testifiers, and of course we want to hear from students and parents. So Senator Uyghur.
Well, maybe just briefly to Darren, give us the financial situation in terms of the state's ability for reimbursement and whether you project additional revenue request. And then on the attendance, an important issue, I want to make sure the local school board can set additional requirements regarding notice to parents and consequences in addition to what we have in the books, recognizing the importance of local control. And then my questions to Dr. Crane, they were submitted, but I would sure like to hear from the commissioner regarding protection for staff, for teachers, for the whole team in terms of measures that are being done too. For now, that completes my question. Thank you, Madam Chair.
Thank you, Senator Uyghur. So, Mr. Cordy, if you have some financial information that you can depart quickly, otherwise we'll follow up. We'll have you follow up in a memo.
Sure. Just specific to transportation, Madam Chair and Senator Uyghur. We have heard that, especially for those operating in a hybrid model, that there are some increased costs that pupil transportation directors have told us about that may result in some impacts, to their budgets because that basically the aid that they're receiving is not keeping up with the additional costs of funding routes. Because if you're in a hybrid model, as you know, you can only have up to 50% capacity on your buses, which just is requiring them in some cases to run more routes than they normally had planned. And if they're working with contractors, that can generate additional costs.
Thank you, Mr. Cordy. And if I could ask the commissioner to follow up, if she's still on, in a memo regarding the authority that local school boards have regarding notice and follow-up of attendance. And Senator Uyghur had another question, Commissioner, about staff protection. So if you could follow up on those, and we'll make sure they get to the full committee and see if we can get those posted. So thank you. Thank you, Senator Uyghur. I don't see any other questions at this point. Let's bring up the rest of our testifiers quickly. We do want to make sure, we want to hear from Christy Hovanetz. Dr. Hovanetz is going to talk to us a bit about the assessment piece and how do we know how our kids are doing? Ms. Hovnitz.
Yes. Chairwoman Nelson, members of the committee, thank you so much for the opportunity to talk with you today. I'll just move fairly quickly through this slide presentation about assessments and why we actually bother with them.
Thank you.
I represent an organization called the Foundation for Excellence in Education. We're a 501c3 based out of Florida, based on former Governor Bush's policies in Florida. So when we talk about assessments, we're talking about making sure that students are able to meet the grade level standards set forth for them by the state of Minnesota. When I'm talking about assessments, we have these comprehensive and coherent systems of assessments, but when I talk about assessments, it'll only be addressing the state level end of the year summative assessment, so your MCAs. We do expect that local districts, as Jennifer Dugan talked about earlier, will continue to administer all of their assessments, their screenings, diagnostics, progress monitoring, and make sure students are on track. But we do need to make sure that we are still looking forth to our summative spring assessments. We test students for multiple reasons. Parents need honest, objective information about how their children are doing, and we need that information objective statewide, so it's comparable district to district. We need to identify students for additional support, make sure that we're upholding our promise to equity, make sure state policies and interventions are working. And this is very key this year in that we have an information void from last year on how we did with distance learning and hybrid models and how we're going to be doing this year. We also need to make sure that we're meeting workforce expectations and being accountable for taxpayer money. We know assessments alone don't improve student outcomes, but what we get from these assessments is information that will inspire action. So how do we know if students are learning amid COVID? Minnesota is not unique. The nation knows very little right now about whether or not students are making a lot of progress or have been successful under distance learning measures. There has no precise information that's come out, and it probably won't until we get those objective state level pieces of information where state departments can start analyzing and looking at what's happened across the state. There have been a couple of studies that have come out that have projected learning loss. This information is using data from the NWEA. It's only from selected districts. It wasn't given with the intention of doing these analyses. And as you know, that NWEA is administered in usually pretty minimally secure environments, and the information is generally used to guide instructional practices. So not a perfect assessment to use, but the only information that they have available. McKinsey and Company did a study that they've released results for. Essentially, they're creating statistical models on the impact of potential closures. So guessing on what the closures will be, looking at different scenarios on how COVID will spread and what the impact of that will be, and using the NWEA data. So based on those three different variables and components, they looked at different scenarios and whether or not students were at risk for significant learning loss. They did find, not surprisingly, that they do think that there will be some learning loss, that learning loss will probably be greater for low-income Black and Hispanic students. And then their concern is that those learning losses will lead to losses of earnings and losses of long-term GDP and economic impact. And the Collaborative for Student Growth also did a study to guess the potential impact of school closures using NWEA data. This research was published earlier this year and is based on looking at prior studies of summer learning loss. The research on summer learning loss is variable. Some studies, if you do a meta-analysis, will show that there were major declines. Some will show some small minor gains. It just really depends on the study you're looking at and what information is actually provided. So the meta-analysis on this is very mixed. And also with the summer slide, you're not providing any instruction at all. So these might be overstated estimates of how much students are learning. We know students participated in distance learning to varying degrees, so we know that there will be some learning occurring, and in some districts, a better opportunity for learning for students. And we also know that the impact of when the state testing window will also impact what the results would have been from prior years. So Minnesota was in the midst of the testing window. It had already opened when schools shut down for certain. So we are in an information void. but some of the studies that have come out are best guesses at how much learning loss there's going to be, and we really won't know anything concrete until we get state summative assessment results, which is why it's so very important that we do that. Just a national perspective on state level summative assessments and where states are looking right now. As you know, federal law requires administration of state assessments annually. Last year, this requirement was waived by the U.S. Department of Education with the authority of Congress. 3 states this year have already requested waivers. None of them have been approved. The U.S. Department of Education is holding very strong, and Congress has not given authority to the Secretary to submit waivers yet. There are some states that are being called on to look at and review what their testing procedures are. Some states are doing some unique and fun things. Texas is offering their state assessment to parents. So if they want to test their child at home to see how well they did and the impact of learning loss and distance learning on their individual child, they can sign up and actually take an administration of the Texas assessment, the STAR. Florida also is being committed to spring assessments. They're also adding a free administration of ACT and SAT as well this year using their COVID or CARES Act funds because of COVID. And they also are offering an administration of their statewide assessment as demanded by charter school operators. So a group of charter school operators, 150 charter schools in Florida, wanted to administer the state assessment to see where they were as well. So some states are doing some unique things to make sure that they're getting some information. It's not a universal administration in this fall, but it is important that we have a universal administration in the spring. So hopefully, as things stand right now, states are going to be administering their state assessments in the spring. We do need to still report proficiency results transparency. There's still a lot of reporting requirements that come with ESSA. We do need to know and be able to identify and allocate resources and supports based on these assessment results. Even if we don't have comprehensive accountability systems that look at multiple indicators, we at least have information about how students are performing. Local districts still should only be accountable for preparing students for success on meeting grade level standards and masteries. State departments, it's good to hear the department is providing advice and guidance on how to use formative assessments appropriately and maybe making some suggestions on which ones are aligned to state standards. But at the end of the day, local districts are still responsible for making sure that instruction is moving smoothly using assessments. And then finally, for 21-22, really starting to work to rebuild those accountability rating systems. This year, because we didn't have data from last year, it's going to be hard to get growth information, hard to get reliable information on lagging graduation rate indicators and other lagging indicators. So really thinking about this year as a rebuilding year using the new assessment information from the spring to build out assessments and accountability for next year. So that's all I have for that. If you have questions, Chairwoman Nelson, still free to answer those after the fact as well.
Oh, thank you. Dr. Hovnitz, that was a insightful and fast but fact-filled presentation. So I know we will have questions for you, and I want to make sure members know this presentation is available online as well. So we'll hold off on some of those questions. I know we have some students that we need to get to as well here. Thank you, Dr. Hovnitz. I'm impressed with Texas. Let's empower those parents. Next on our agenda, members, is Alicia Carlyle and Sunny Case, both from Proto Academy. I'm going to ask that you step up here, introduce yourself for the committee, and please state your name. I may have mispronounced it. Ms. Kalama, welcome to the committee. Introduce yourself for the Zoom, please.
Can you hear me okay?
Yes, yes.
Hi, everyone. Good afternoon, Madam Chair, members of the committee. I think in this timing, I'm feeling a little constrained for what I prepare. But what I can say is I'm a Title I educator from Purdue Academy, and I engaged with over 700 parents this past few months, leading recruitment and enrollment efforts, and getting families to enroll in our new campus. In addition to that, I manage our engagement with families throughout the school year to make sure they're able to be successful. In my 14 years as a practitioner, I can tell you I know schools, I know families. I've been a teacher before becoming a charter network leader. And today I wanted to speak on behalf of families. Us as a network, we did survey our families to see what we were going to amplify. And again, we rolled out to several community-based organizations, several surveys from about 19 different high schools. And the findings are extensive. I would say it wouldn't do justice to try and fit them in these few minutes. So I hope that the Senate can welcome me back to share those findings. But what needs to be amplified is our families are really yearning for more accountability and support when it comes to technology as the topmost concerns. And I'm happy to share these findings with you kind of as they present across the metro area in St. Paul, in Bloomington, in Dayton, in Blaine, in Minneapolis, largely to Title I students. So with that, I yield to Sunny, and I hope I can be invited back.
Oh, yes. Do you have those results that you can leave with the committee so we can go over those results?
Yeah, I have every prepared.
That is wonderful. Take just a moment and tell us about St. Paul, if you could. Can you just do one quick snapshot?
St. Paul is really diverse, and so as we would engage with parents, we were finding that findings were all over. And I should kind of preface this in saying, in working on the recruitment, there were a lot of conflicted interest once COVID hit, and we were underprepared. And so I'm getting a lot of feedback as well. I'm gonna turn just straight the computer on. Can you hear me okay now?
Yes.
Oh, I think you might have been hearing me from the computer the whole time. In St. Paul, what we're finding is that diversity led to a diversity of opinions from our families, and with the conflicted interest of needing to recruit a whole entire new school, our St. Paul campus, for context, was under-enrolled. And so there was a huge push for marketing and for messaging that would calm the fears of parents during the recruitment season. And that being said, as parents were giving feedback as far as what they wanted to see for distance learning, our school was just promising parents that, quite honestly. And that's why I say I testify on behalf of families today, because that conflict of interest led to a lot of mixed messaging to parents. What our school eventually did around May is say to families, we're going to offer everything. We're going to offer the distance, the remote, and the hybrid option. And so stick with us, stay with us, come to our new campus, and again, as well, apply if you don't know about us. And what was really behind closed doors is me as a very stressed engagement and recruitment manager saying, I don't know if we can do this. And so in engaging with families, I just tried to amplify the need for communication and the need for accountability systems as we're promising families what distance learning or hybrid models will look like, or whatever models, a need for accountability. So this past week, I did partner with several community-based organizations to roll out what was called the Minnesota School Reopening Equity Report Card. This was rolled out to parents in 19 different schools throughout the metro area, and it asked parents to grade, yes, this past school year, as well as what they anticipate for their schools if they're returning for this upcoming school year, as well as what they anticipate for their schools if they're actually going to be transitioning to a new school setting. And those findings were also, should I stop? I see face.
Yep, I just wanted to, I'm hoping that we can get those findings. Thank you. Thank you so much. I want to make sure we can hear from the parent who is with you, Sunny Case. And then we do hope we can get you back before the Education Committee as well. And if you can share those findings with us, that'd be very helpful, I'm sure. So thank you. Miss Sunny Case. Welcome.
Sure.
to the
Hi.
committee.
I just want to make sure that I'm differentiating that I'm actually not with Perdeo Academy with Melisa. She and I just met as having some commonality as both speaking today as community members. So,
Okay.
Right. So I'm here as a parent. Good afternoon, Madam Chair and members of the committee. My name is Sunny Case. I'm the mother of 4 children who've all attended St. Paul Public Schools. I've experienced in all levels of the public school system. My son William's a 5th grader in elementary school. My son Patrick is an 8th grader in middle school. My son Thomas is a sophomore at St. Paul Central High School. And my oldest son Joseph is a sophomore in college at the UW-Madison. So since the time I brought my first child to the St. Paul Public Schools in ECFE, early childhood family education classes, I've been a really engaged parent. I've led PTOs at all of their schools. I've volunteered my time and my voice and my commitment to making sure that all children have an equitable education. I've also worked a full-time job, and I actively support students of color who are attending colleges. I'm here today to speak as a CAL leader. So CAL is the Coalition of Asian American Leaders, and they've really given voice to this Asian American experience here in Minnesota. And they really trained community members like myself to come out and share experiences. So particularly in these trying times that COVID has presented to us, we as CAL organizers have been very purposeful in getting out and sharing our experiences. So all that to say that my reflection on this last spring, this summer, and what we have ahead of us facing education for children, it's all really hard. It's incredibly hard to be a parent, to be a student, to be a teacher, to be an administrator. In fact, it's just hard to be a human right now. And the virtual learning aspects have been really challenging for our family and for many other Asian families that we know. For the majority of Asian American families, education is very important, and school is a microcosm of our greater, larger society. So what I witnessed happening in education in this last time of COVID is that all of our hardships and challenges were just really exacerbated by the distance learning experience. Right. So when we moved into distance learning, I saw so many students supporting not just their own learning responsibilities, but also managing the teaching, tutoring, homework for their siblings and helping their parents get off to work if they were leaving the home and supporting them if they were in the home working, all while trying to do their own work. I saw many examples of this. So what didn't work about many distance learning options was this lack of resources. Here's an example that I wanted to really lift up. It's the idea of technology being available for all. I've heard lots of voices around this, but my example would be, even in our household of 6 people, the bandwidth, we're very privileged. We are very lucky. We have fairly reliable Wi-Fi in our house, but when 6 people get on it, it becomes really hard for it to be reliable. So for my kids, when teachers ask things like, turn on your screens, show me you're here, some students felt really self-conscious about their home surroundings, and they did not have the Wi-Fi capabilities to make that video option work. So right away, they were set aside from many of their other counterparts to use technology, which meant it's what we're relying on to make distance learning and even the hybrid work. So we're really privileged in our family to have those kind of resources. In this next iteration of whatever learning looks like for Minnesota, be it distance learning, in-person, hybrid, we all know that technology is going to be something that we're still going to be leaning on. And so a real strong suggestion that I've heard across the board is that we get on the technology. So distributing iPads, laptops, Chromebooks to all students statewide, making sure that they're accessible, providing free, open, public internet access for families and communities who aren't able to provide their own Wi-Fi so many of my children's friends just scrambled for Wi-Fi and tried to get as close as they could to libraries or places that were offering free Wi-Fi. So
Thank you. Do you have a little bit more? I just wanted to, I think
Sure.
you're setting us up well for what we need to do.
Yeah. So when they asked me to present, I just wrote this out. So I'm just going to keep reading it unless you have specific questions as I'm going through. So that part was on technology. You know, another challenging part of distance learning for our family that again was just exacerbated. It existed before, is that all of my son's teachers, every single one of them, identifies white. And why is that important? Well, I think now more than ever, it's important because my children need to have access to teachers in Minnesota that reflect their own life experiences. They need to reflect who they look like and what their experiences are. So I'm really asking you all to think about how to create dedicated efforts that create teaching forces that include more teachers of color. You know, the last area I want to talk about is that I wanted to share the need for our community as a whole to come together and address what I perceive, and many do, as a really deep racial divide in our state. So in my experience and our family experiences, all educators and students would really benefit from some racial equity training and anti-bias education. So when COVID first arrived in this country and then to the state of Minnesota, many people referred to it as the Chinese flu, and it became associated with a lot of anti-Asian sentiment. And I've really told my children that we've been given this moment to reflect and learn to be better humans to each other. So some very specific ways that I hope that our state can create that racial equity framework is to ask all districts and for you to fund programming in all districts that commit resources to educate employees, students, staff, and commit these resources to ensure that the curriculum and future DEI trainings are inclusive and reflective of the Asian American experience. So as I am your last speaker, I will end saying this. I really just want to be seen and heard. I want my history to be told and not erased. I think that Asian Minnesotans are very often an invisible community. And we're the model minority, we're quiet, we're polite. And in good times, we're often marginalized. And in bad times, we're often targeted in times of crisis. I'm asking that we move.
Yes. I want people to stay on there. There is another speaker, but I do want you to finish. And I do want you to get.
Yeah, this is the third time you've interrupted me, but I can be done. Sure.
Did you get your comments?
No, but go ahead. You can have the last speaker speak. Can I just stamp one thing around our St. Paul campus to Sunny's point? In St. Paul, we have an influx of Karen and Karenni refugees in the recent years. Our St. Paul campus is overwhelmingly at over 70% of these recent refugee immigrants. And so I just really want to stamp the need to hear that.
Thank you. Clearly, I think we should have perhaps another hearing. I have been notified that we can continue on at least until 3, so we may even be able to get some questions at the end here as well. We do have one additional speaker, and this is, I'm going to have, while they're getting ready, we have Karen Edmonds, who's the Executive Director of Project Legacy. And then she will give a brief intro, and then we have two student, Vicky, and also we have a program director, Alicia Carlyle. So if you could get ready, please. And Anne Marie, I think you were going to give a brief update. One of the things that we've heard today from many parents and many students as well, of course, is the fact that things are different and we're going to need to learn how to learn in different ways. And that's one of the things that you'll get to hear here with the Project Legacy innovation that will be happening here in the fall. And Anne Marie, if you could give us just a brief a review of any legal parameters about a nonprofit that might seek to provide adult mentors or pods in pods for students who are cohorting when they're not being instructed. So they're public school students, but they are maybe in their days of hybrid learning when they will be working in a nonprofit with a nonprofit and volunteers to help with that distance learning. And Ms. Lewis, do you have any brief comments on that? Were there any particular legal things that we needed to know about?
Madam Chair, members, I think you all have got the brief memo. In the situation that Senator Nelson described, I think the biggest thing is making sure that the people working with the students have had the background checks completed.
Okay.
So I'll just leave it at that.
Great, thank you. That's always good to know ahead of time. So with that, I'd like to welcome Karen Edmonds. Mrs. Edmonds, are you there? Can you introduce yourself for the record, please?
Hi, I'm Karen Edmonds. I'm a former special ed teacher. I also worked at MDE for a period of time. I want to just very quickly acknowledge Sunny's very important comments. I hope that everyone takes the time to really think about what she was saying. Very, very important. And thank you for that, Sunny. We're right at the end here. And so I'm going to not read any of my remarks because I want Vicki Mariel, who is our student, to have time. And then Alicia Carlyle, who's our program director, I want her to have all of the time. So Project Legacy MN, you can read about us. Right now, I'm going to introduce Vicki Mariel. She is a sophomore at Mayo High School, and she's going to share some thoughts about her distance learning experience. You can take
Vicki, welcome to the committee. If you could introduce yourself for the Zoom, please.
Hello, my name is Vicki Mariel, and I'm going to be a sophomore at Mayo High School. My experience with distance learning wasn't the best. Some things that made my experience difficult were that some teachers weren't sure how we were going to meet online. When we did schoolwork, the instructions weren't very clear, and it was kind of hard to understand how grading worked. Another reason is that teachers weren't always available, and when they were, there were multiple students that they had to work with, so it was hard for me to get the help that I needed. Aside from school issues, I wasn't able to focus because of the responsibilities that I've already had at home, and sharing electronics with my siblings was hard to do as well because of the classes that we all had. And that is why I'm excited that Project Legacy will be having learning pods that Alicia will be talking about now.
Thank you, Vicki, for sharing your experiences. And I'm excited too to hear about what's coming next for this year. So if you could stay on in case there's questions. Alicia Carlyle, welcome to the committee. If you could introduce yourself for the record, please.
Hi, my name is Alicia Carlyle. I'm a youth development specialist here in Rochester, Minnesota with Project Legacy. I prepared something, but I'll try to be brief. When our district made the switch to distance learning last school year, the youth that we served were left in the dust. They didn't take, I don't believe our school district kept families living in poverty in mind. They didn't have access to Wi-Fi. They depended on schools for meals. It was just a lot that really kept them from being able to be successful learning in a virtual learning environment. Project Legacy knew this year that we had to do something to recreate a structured school-like environment, which moved us to create our learning pods. We will be using our 3 office spaces, 2 youth in each room, to create a self-contained learning environment. We have a Mayo Clinic pediatrician on our board who keeps us informed about the latest COVID safety protocols. While youth are utilizing our learning pods, we will be providing healthy meals and trauma-informed support services. We have licensed teachers who have volunteered and are committed to teaching our youth this school year. As of today, none of our families have received schedules or detailed information about what distance learning is going to look like for our middle school and high school kids, which is extremely stressful because every single participant in our program is living in poverty and they don't have access to the resources that middle-class families have. So they're struggling. They don't have the ability to make quick decisions and pay for childcare, and do all the things that a lot of other people have the opportunities to do. After announcing our learning pods, we had many families in the community reach out that are not a part of our program. Due to lack of funding and space, we just don't have the capacity to meet the growing need in our community. Personally, as a single parent and a full-time college student and a full-time employee, I also worry about the quality of education my own child will be receiving during distance learning. I can't do it all, and many other parents, we can't do it all. So many parents are stretched thin right now and don't know how they're going to support their children academically. There are programs in Rochester and in surrounding areas that are offering learning camps, but unfortunately, these are not accessible to a lot of families due to lack of transportation and just unbelievable cost. I believe Project Legacy is making a huge attempt to try to bridge this gap by offering our learning pods free to the youth that we serve. And we would love the opportunity to expand and be able to reach more families because there's a lot of people that are really struggling right now. I kept this brief, but if you have any questions, please, I'm here. Thank you.
Thank you. Thank you so much. I am just speechless, really, about the terrific presentations today. And I specifically, I know Sunny and Maisie and Karen and Alicia particularly did not get to formally present their full presentation. And I believe I heard each of you say you've got that written. If you would kindly share those documents with us, I think this is really critical. I know that our members would very much like to have access to the information presented today. And I do apologize, that first part of our hearing took much longer than we had anticipated. But I do want to, and I've seen some questions here or in the chat feature as well. But I want to thank all of the participants today. Certainly, we want to do everything we can to make sure that all of our children, every one of our students has access to the high quality education that is needed for them. And it's particularly challenging in a pandemic. And I'm glad to see so many innovations and really people working together, our medical communities, our educators, our parents. Thank you so much. Please make sure we have all of your documents, and we will share them with the committee and get them on our committee page. So again, thank you so much. This meeting is adjourned. Thank you.